My name is Saiken MD, and I'm a Dr. VTuber and internal medicine doctor in real life. For this episode, Bianca wants me to talk about idiopathic intracranial hypertension, so let's do it. To start off, idiopathic describes a process without a completely proven or understood etiology or mechanism of action. The current theory of IIH has to do with impaired reabsorption of cerebrospinal fluid, leading to too much volume being present in one fixed space. Common risk factors for developing this condition are being a female sex and childbearing age, having a BMI of greater than 30, being on oral contraceptives or other specific medications like tetracycline antibiotics, weak androgenic steroids like danazol, or high levels of vitamin A like isotretinoin for acne. Patients with IIH will most commonly present with a pulsatile headache, nausea and vomiting, and double vision. On examination, patients may have visual field loss, an inability to abduct the eye due to compression of the sixth cranial nerve, or classically show papilledema on fundoscopic exam. We start with an MRI in order to demonstrate the absence of any secondary causes of increased intracranial pressure like intracranial masses. Then we know we can safely proceed with a lumbar puncture, which is the gold standard diagnostic test for IIH. In a lumbar puncture, the provider inserts a needle into a patient's back, specifically into the subarachnoid space of the spinal cord. This is a direct draw of the body CSF and helps us get insight into the composition of the same substance that's flowing around the brain. LPs and CSF analysis are invaluable tools in diagnosing infections like meningitis, cancers of the central nervous system, and demyelinating diseases like MS. But in IIH, we're mostly concerned about recording the opening pressure. This value is usually between 10 and 25 centimeters of water in adults, with IIH patients usually sitting in the greater than 30 range. Once a diagnosis is confirmed, patients are started on a carbonic anhydrase inhibitor like acetazolamide to decrease the rate of CSF production. Many improve symptomatically within a week, although a fraction of patients may require a surgery such as optic nerve sheath fenestration in order to preserve vision if refractory to medical therapy. If you want to learn more, if you're interested in pre-med or going to medical school to become a doctor, follow me on Twitch and X at SaikenMD.